Hey guys, I'm back here with you today. Wanted to talk to you about when you should see a chiropractor versus when you should see a medical doctor. So the first thing I want to cover is what's the difference between a chiropractor and a medical doctor? Well, both professions go to school for approximately 8 years to get their degree, okay? And a lot of the coursework is similar. Both are going to learn all the information about anatomy, physiology, diagnosis, immunology, virology, all the different ologies that you can think of, including radiology, looking at x-rays, MRIs, okay? And so once you get done with school, then you go on as a medical doctor. You may do rotations for quite a while, sometimes several years, depending upon what specialty that you want to specialize in, okay? Whereas chiropractors, when they graduate with their degree and they're licensed, they go right into practice. Okay, so now some chiropractors will continue to go through school in order to specialize it as well. For example, there are chiropractors that specialize and get diplomates in extended education in pediatrics, radiology, neurology, and so there's different specialties within chiropractic as well. Now, the really beautiful thing is that we can work together really well. Did you know that chiropractors, medical doctors, and doctors of osteopathy are all three considered to be primary care providers? What that means is that we can see anyone in our office without the need for a referral from another physician. In other words, you can come right in off the street and become a patient and get under our care. Now, what it also means is that we're specially trained in how to recognize and diagnose many diseases and conditions and things like that. Now, the focus of a chiropractor is not necessarily to diagnose and certainly not to treat lots of diseases and illnesses and conditions, okay? What our focus is on maintaining the health of the spine and the nervous system. Now, one of the beautiful things is that, especially in an office kind of like ours where we do memberships, is that when you come in for routine care and maintenance, we can oftentimes distinguish when something is minor or major. In other words, we can help you decide, okay, do I need to go to the ER for this? Do I need to go to my medical doctor for this? And we will refer you to a physician to have that done. In fact, in our office, we do that all the time. We refer our patients to physical therapists, to orthopedists, to medical doctors, to neurologists and neurosurgeons. We refer to all different specialties because we really know that we can work together well. And so there's no favorites in this game. And so I wanted to share just a couple tidbits. And another thing you could think about is the more that you see your chiropractor, it's more likely the less you're going to need to see your medical doctor for major things. Why? Because we can help you with all the more natural approaches. In other words, keeping your spine healthy, keeping your nutrition on track. A lot of times we can prevent these major diseases and illnesses, or at least help people recover while they're being managed by a medical doctor. Another great thing is, let's say that your kids are under care and they're getting their spine checked routinely and their nervous system's working well, keeping the illnesses down. Let's say that they do come in with the stuff, a runny nose or a fever or something like that. Oftentimes we can be that person to say, hey, look, I know you came in just for your regular chiropractic adjustment, but I really think you need to take your kid in to get them checked for this. Maybe it's a skin condition, a rash. Now, is a chiropractor always going to remember every single thing that he learned in his textbook from school? No. And that's why we refer. That's why we refer to someone who specializes in dermatology. Now, a person that specializes in dermatology may not know everything about the endocrine system like a medical doctor that specializes in endocrinology will, okay? Or a chiropractor who specializes in functional medicine for that matter, okay? So the point is that primary care providers are able to span a general reach in order to say, hey, look, I see you got this going on. I may not be the expert in this particular thing, but I can send you to someone who is, okay? So in other words, number one, chiropractors are going to help you keep the spine and nervous system working great, keep you healthy, keep your nutrition on track. Okay, we're also going to be able to help you say, hey, look, there's something deeper going on and you need to go to somebody who specializes in this so that they can help you out. So you're not just running around going, you know, a million different places. And that's one of the beautiful things about primary care providers. So we recommend that everyone is under chiropractic care, and that everyone also has a medical provider that can manage their health as well. And we work real closely with Trailhead Clinics. We really like them, and we refer a lot of people to them. And so we'd encourage you to jump on that. And one thing that we love about Trailhead is that they do memberships like we do. So it can really make it an affordable way to prioritize. Thanks, guys, for checking in, and just wanted to share that tidbit with you. Have a good day.